will be the first interpreter today. And with that, we will start.
Wonderful. Well, good morning, everyone. Happy Friday, and welcome to today's meeting of the Autism Spectrum Advisory Board. We have a jam-packed schedule for you today. We're going to start with introductions, but that will shortly be followed by a presentation from Dina Gassner, and she will be introduced by Michael Gilberg, and she will present on the impact of COVID-19 on individuals with autism. That will be followed by a presentation by Employing People with Disabilities with John Robinson. So I want to thank both of our presenters ahead of time for joining us today. I also want to thank Patrick Paul because I may have to step out a little bit early from this meeting today, and I believe Patrick is going to take over as the moderator for me when I have to do that. So in order to start the meeting off, let's do some introductions before I turn it over to Mike Gilberg to introduce our first speaker. And let me start by first thanking our interpreters today, Maria and Jennifer. Thank you for being with us. I'm going to go through the list of participants that I see to call on folks. So get ready, because I'm going to just ask you to briefly introduce yourself. Just say your name again and your role. And alphabetically, the letter C comes up first on the list of participants today. So that's Salon. So Salon, would you like to introduce yourself this morning if you are here with us?
I am. Good morning, I'm Salon Myers-Ruff, Deputy Commissioner at the State Education Department in Access, which is Adult Career and Continuing Education Services.
Wonderful, good to see you, Salon. Next, we'll go to Dina Gassner.
Hi, I'm Dina Gassner. I'm going to be speaking with you folks today.
Wonderful, Dina. We'll introduce you in just a minute. Michael will introduce you in just a minute. Dixie.
Hi, good morning. I'm Dixie Yonkers. I work in the communications office at OPWDD. It's nice to be here.
Great to have you, Dixie. Good to see you. Donna Bradbury.
Good morning. Donna Bradbury. I serve as Associate Commissioner at the New York State Office of Mental Health. For 9 years, I served as the Director of the Children and Families Division. But just a few months ago, we created a new Office for Prevention and Health Initiatives, and I'm now with that office. So good to see you. Good morning.
Yes, good to see you, Donna. Let me next go to G's, which is Greg. And Greg, thank you as always for all the work that you do to put these meetings together and support the work of the Autism Advisory Board. So Greg.
Thank you, Chairperson Burke. I'm Greg Roberts, the Director of Legislative and Intergovernmental Affairs for OPWDD, and I am fortunate enough to be the staff person to help organize the board meetings and to give the board members what they want, hopefully for these meetings. Thank you.
And you do a wonderful job of it. Okay, Helen Yu.
Good morning. My name is Helen Yu. I'm a research scientist at the Institute for Basic Research here in Staten Island.
Great. Next is John Robinson, who will be our second speaker today. So he'll get a special introduction in a little bit, but John, if you could say hello, that would be great.
Good morning. It's good to see everybody. Happy to join you today and look forward to sharing with you what we've been doing.
Yes, great. Okay, we'll move to Josh. Josh, I don't have a last name, so hopefully you're the only Josh on today.
Yeah. Sorry. First of all, sorry for some technical issues. Sorry for late entry. Yeah. Hi everyone. I wanted to bring up, if possible, two little things which people have asked me to bring up, because what I often do is since I work with a lot of other people on the spectrum, and since I help run Sounds Like Autism, the podcast, I'm in contact with folks from all the state and country. A couple of things they wanted me to bring up very badly is, one, they want to feel that they have direct access to us. Ever since I told them about the board, they got very excited. As I said last time, like, oh wow, we have a voice in government, and that's exciting when you feel that you've always been left out. And so they want. So I've been thinking. I ran this over with a bunch of them because I want to know their opinions on it. Because to me, since I'm autistic and a representative of the autistic people of the state, it's important for me to get a diverse collective pooling of ideas. Lots of them was that we had a social media page, or a page which they could access the board and send their ideas, their thoughts on things, and then from there we could, like, let's say we get 50 things on one topic. Like, let's say this is hypothetical. They feel that when people say Apple, it's offensive. Again, hypothetical. If we get 50 things for that, then we should discuss it. Like, okay, why is this happening? Why are they, and how could the state of opportunity move forward to address stuff like this? Because I firmly feel, after talking to them, and as an autistic person myself, that lots of times people feel that they speak for us, and that is a big thing. That's huge. Because that's one of the reasons why people like usually get upset, because they say people speak for me. I don't get to speak for myself. I can't express for myself, and I fear that may start happening here, and we should be listening to their direct voices. I think that's extremely important. And I know it's really important for them, because I cannot emphasize the large number of people who have brought this up to me. I cannot emphasize that enough. The second thing is not so much what they said, but it's what I've been thinking and stuff. So I've been doing a little research, and I know that in the past, this group, before the delightful events of 2020, used to meet in Albany. And now I know it is like much more convenient, first of all, to meet like this, but it says a lot to the people if they're like, oh, they meet through video chat, or oh, they actually go to the Capitol. That's saying a lot about value, because if we were to meet with the governor, who I actually met with right before she became governor, and she's a huge friend and supporter of people on the spectrum, like huge. That says a lot value-wise, because if you say, oh, they're meeting on video chat, oh, okay. Oh, they're going to the Capitol. Oh, wow, that's important. And that brings a lot to the table. And that really says something about how the state values you and values your population. And to me, the whole thing is about value. It's like, think of like corporations. They have like their core values, and they really stick by them, they emphasize them, and it really says who they are. It really kind of separates them from the rest of the pack. And I feel like that can be us, because I don't know if other states have autism boards, but I do know that I want to be part of the very best one. And New York is called the Empire State for a reason, but we got to keep that title, and eventually we do every day. And I really think that this is a way to kind of pay for it and show through action, not just talk, that, we value the folks on the spectrum in our state.
So Josh, thanks for that great input. I like both the main ideas that I heard. One was about social media and providing sort of more direct access and a space for people with autism to express those views. I think that's a really intriguing idea. That might be something, I don't know, I defer to Greg, that the OPWDD can facilitate. And your second point about the importance of in-person advocacy, I definitely think that we're hopefully, fingers crossed, starting to move back into a time in this pandemic when that's going to be more possible as a way to advocate and make sure your voices are heard. So strong endorsement for both of the things and suggestions that you made. So there's a lot of good points. So thank you. Really appreciate your input. Okay, so we'll go next to Mary Lou. You're next on the list if you're there to introduce yourself.
Good morning, everyone. I'm Mary Lou Cancelli. Live on Long Island. I'm an advocate for the individuals who do need our support on Long Island, as well as the state of New York. And been with this committee since it's begun. So I'm a ex officio, was appointed by Todd Kaminsky.
Great. Thanks, Mary Lou, for being here today and for all your contributions thus far.
Thank you.
Next is Mike Gilberg.
Michael, I have a pet peeve about Mike, but I'm one of the self-advocates. I'm a special ed attorney, and I'll talk a little more when I introduce Dina, so I have nothing else to say right now.
Great. All right, thanks, Michael. We'll introduce you in a second. Mike Tripodi.
Hi, everybody. My name is Mike Tripodi. I am the disaster program specialist for Eastern New York, covering Washington, Warren, Saratoga, Albany, Schenectady, and Rensselaer counties. Kind of a new position from the last meeting. I'm an autistic adult who's also vice president of the board of directors for the Autism Society of the Greater Capital Region.
Great, thank you. So thank you, Mike. Patrick Paul and Patrick, let me thank you for potentially taking over to facilitate this meeting today if I do have to drop off. Thank you, Patrick.
It would definitely be my pleasure. No problem. I am Patrick Paul, the CEO of Anderson Center for Autism.
Great. Thank you, Patrick. Renee Ryder, you're next.
Hello, everyone. Yeah, thank you, Courtney. Hello, everyone. Renee Ryder from the New York State Council on Children and Families.
Great to see you.
Thank you.
Sarah May Pratt, are you on today?
Yes, good morning. Can you hear me okay?
Yes.
All right, having some connection issues. My name is Sarah May Pratt. I'm the founder and owner of Puzzles Bakery and Cafe in downtown Schenectady, where we specialize in employing individuals with developmental disabilities. And I also have a loved one on the autism spectrum.
All right. Thank you, Sarah, for being with us. And last on the alphabetical, but not least, is Vicki. So Vicki, if you're able to say hello, please do.
Sure. Good morning, everyone. I'm Vicki Haifa. I'm the acting executive director for the New York State Developmental Disabilities Planning Council.
Great. So that is everybody on the board today. Is there anybody that joined after I started introductions that didn't get a chance to introduce themselves who's on the advisory board?
Yes, good morning, Courtney. It's Christopher Soriano, Assistant Commissioner for the Office of Special Education, State Education Department. Morning.
Anyone else? Okay, so just to review again, I'm going to hand it off to Michael Gilberg, and we have two presentations today. One on the impact of COVID-19 on individuals with autism, and a second on employing people with disabilities. We'd love to have a little discussion on both topics. So without further ado, Michael, thank you for doing the introductions today.
Yeah, thank you, Courtney, for giving me the opportunity. I personally asked to introduce Dina. She's a friend and somebody who's been a leader in the self-advocate community for a very long time, and probably one of the top 3 or 4 self-advocates in New York State. And so it was my pleasure to introduce her, and I will look at the bio. Dina is an adjunct faculty member at Towson University and a PhD candidate at Adelphi University. She was recently appointed to the Interagency Autism Coordinating Committee, IAC, which is a body that reviews current autism research and uses that to advise the presidential cabinet on the priorities for autism funding. I will note she's one of a very few self-advocates on that. She's the co-chair of the Autistic Researcher Committee for the International Security for Autism Research, INSAR, and is a national board member for the ARC US. She coordinated the INSAR opening special interest group, which is a 3-year research project beginning with building on the strengths of autistic scholars and addressing systemic barriers to autistic success in academia. She is extensively networked and published and has provided training events to the United Nations in Russia, England, Copenhagen, and other places. And as I said, is one of probably the leading self-advocates in New York, if not the country, and a mentor to many, especially women on the spectrum. But I'll let Dina take it away.
Thanks, Michael. Do I have the ball?
Yep, Dina, you are all set to share your screen or the application, whichever you prefer.
Okay, thank you. All right, everybody. Well, thank you for having me. I will try to multitask. If I mention anything that's a specific word or a phrase that you don't understand, please interrupt me in real time. Otherwise, I'd appreciate it if we could take questions near the end. So I'm very, very grateful to be here. I'm very excited about the representation on this group. It's really exciting. I wanted to start with my best COVID picture. This is my long COVID hair. And my husband took this picture in a restaurant, and I just think it captures the angst we've all been experiencing as related to COVID-19 and how it's affected the IDD community. So let's jump right in. Uh-oh, let me see, different way. Okay. So, you know, when people ask us, why should we put so much effort into addressing the needs of autistic people? The reality of it is that it's sort of a cacophony or a combination, if you will, of a lot of other conditions, symptomology, all compacted in one person. So anything we learn about autism may be able to shine some light into individuals with ADHD, for example, or learning disabilities. I also think that, you know, that autistic people are kind of the canaries in the coal mine. When they're not doing well, when we're not succeeding in society, it's almost a reflection of the status of the rest of the community, right? And so people with disabilities were among the first that were impacted by COVID-19, and then we saw the trickle down go from there. So I'm sorry, can you close your mic if you're not speaking? Because I hear people's texting going on. You know, as you can see, the working memory issues, regulation issues, cognitive problem solving, initiating activity kind of overlaps with all these other populations. So I just want to reinforce the idea of what we learn about autism, we learn in a way that can help us with other populations. So prior to COVID-19, autistic individuals face never-ending disparities in healthcare. You know, that's a talk for another day, but you know, the numbers of doctors who have no expertise in just providing basic OBGYN care for autistic women, who don't know how to modify their practice settings for autistic and other disabled people, it's astronomical. And I'm very actively involved in trying to close the gap in that. The other thing we have to keep in mind is with each layer of marginalization, with each identity, the disparities and the risks just by being autistic increase. So for example, the highest rate of difficulty with law enforcement, as one example, gets increasingly worse as you add identity. So if you're Black and you're male and you're autistic, you have a much higher risk of having a negative outcome in that scenario than anybody else. So before we talk about COVID-19, let's examine the barriers that permeate life with autism. And more importantly, let's look at the results of the healthcare disparities that we face. So when you look at the ACEs research, this isn't autism specific, but it's about trauma. Of 17,000 participants who were examined through the Kaiser Permanente system in their ACEs research, which is adverse childhood experiences, over 50% of them were middle class and well educated. 50% had an ACEs score of 1 to 4, so it's a 10-point scale of childhood adversity. 1 in 16 had 4 or more. 66% of the women reported at least one experience of abuse, violence, or family issues. 1 in every 6 men said they had been molested. 1 in 4 women said they had experienced sexual abuse. So the higher the ACEs score, the higher the encounters with public systems such as special education, child protection, mental health, medical health, and criminal justice systems. And that's not considering autism, right? That's with no marginalization identified whatsoever. And what the ACEs study have shown is that chronic illnesses such as lung disease, heart disease, liver disease, diabetes, and obesity, and hypertension escalate with each higher score out of the Folletti work. 30 to 70% are at higher risk of heart disease and higher correlation of all these other negative outcomes that are mentioned here. So, oh, sorry, I'm not used to this clicker. So the number one reason we have to look at disparities for autistic individuals is what we're recently discovering in regard to difficulties with stress and coping. In one study, well, in 2 studies actually, 44% reported 3 or more coping challenges. Suicidal ideation by Cassidy and Horosky have said that 66% of those surveyed reported suicidal ideation, but only 35% reported attempts. That's good news, but only 31% reported depression. So a combination of interoception issues, in other words, when the mind and the body are not communicating, combined with initiation difficulties, trouble making phone calls to secure an appointment, and vetting providers, trouble finding providers that are qualified, prevents autistic people from getting the needed services. So if 66% are reporting ideation, 66% need services, but only 31% are getting them. The evidence is saying that the average life expectancy for autistics is around 38 years of age. And we have a 5 times higher rate of suicidal attempts. So I guess I should take a little pause there and sidetrack and say my son was diagnosed with autism at 3 with intellectual disability. I wasn't diagnosed until 40. So when I say we, I mean all of us. So let's move on. Evidence of need number 2. Again, another Kaiser Permanente study, because their systems are so good at recording data, reported higher issues with these chronic health conditions, including seizures. Bergen Stoddard out of Canada started pointing to these disparities: delays in treatment, increased complications when they show up, they're really significantly impacted, trouble with executive function and managing their health care, frequent over-medication, communication difficulties, anxiety, depression prevent them from accessing providers, as well as a lack of qualified people. There is a greater experience of gender expansiveness and the associated reproductive health care that comes with that. More autistic people identify as gender fluid and expansive than the typical community at large. They have higher than, and then they reversed that study and examined for autism in the gender fluid LGBTQ community and found higher than typical rates of autism. So it's been examined from both perspectives. Are autistic people more gender fluid, or gender fluid people more autistic? And they correlate. Securing healthcare for LGBTQAI and trans persons is extremely challenging, especially outside of urban areas. They also experience the highest rates of murder and suicide in society, especially if they add that marginalization of color or race. And multiply marginalized persons are suffering the most. So while the average life expectancy for most autistics is 37 to 40, it's as low as 35 for most Black trans women. We also endure a lifelong pattern of the poverty of trauma. So I'm glad you're going to talk about employment today. You know, as a person receiving Social Security benefits, I am really struggling to try to transition off of these benefits into first part-time employment and then full-time employment. They do not make it easy. My dissertation is on the lack of accessibility with Social Security. So I have multiple dogs in that fight. So the annual poverty line for single adults is $11,000, but on SSI, it's only $8,830. And that's if there's evidence of need for the entire amount. So inherently, anybody on SSI is living below the poverty line, and that's unacceptable. The overall poverty rate is 14.5%, and for disabled people, it's 28.8%. And I would say that those numbers are a very low estimate now post-pandemic. Pandemic has affected employment and employment training across the nation. We've also seen a pattern, and this is anecdotal from my practice. I've seen a pattern whereby people are being asked to close their voc rehab cases because it's difficult to serve them right now. People are discouraged from applying for rehab services. So, you know, we are seeing a lack of continuity of care from Social Security. I don't have the stats in front of me, but a massive number of people who work for Social Security left because they didn't want forward-facing jobs anymore after COVID. So we're having a lot of difficulties with these services sustaining beyond this. Non-suicidal self-injurious behavior, picking at the nails, cutting, you know, self-injurious behavior is very common in our community. The rates for autistic women are significantly more likely to endorse non-suicidal self-injury than typical college students. And the reason that's significant is it can be a slippery slope into self-harm that's more substantial and then suicidal thinking. There's significant research bias against women and people of color. This was a study that wasn't about autism, but if you look at some of the highlights of this, they didn't research women because they were perceived as more physiologically variable. The complexities of the menstrual cycle are major barriers for inclusion of women, but yet most of the genetic research is done on autistic castrated male rats. So how are we going to know what autism looks like in women if we're only looking through a male lens at a male phenotype of autism? And I want to mention the CDC incidence rate. It says it's 1 in 169 compared to 1 in 63 white children, 1 in 81 Black children, and 1 in 93 Hispanic children. And it's 1 in 169 for women. That doesn't mean it's less frequent in women. It means we're doing a lousy job of identifying it, and our current instruments are not sensitized to more nuanced expressions of autism. Reproductive health care. 80% of US doctors graduate med school without having ever treated a woman with significant disabilities. And women with these kind of healthcare needs have a 3% higher rate of terminal breast cancer. The relatively high utilization of psychiatric services and low utilization of women's health services in transition age youth with autism may have implications for long-term health. Again, we go back to the gender expansiveness. So, we really, really need to close this gap. I'm happy to tell you the American Dental Association is mandating a rotation with people with IDD now as part of their training for all dental professionals. But we need to rewind the clock and close that gap for everyone else. Eating disorders is very common in the autistic community. Again, they did that autism to disorder study and the disorder to autism study, and they're finding correlations there. What's bad about this is eating disorders are much more difficult in our population because it's not about the same factors. Some of the theories around this is that when you have an eating disorder, everything gets a little grayer, it's less intense. You have different kinds of body awareness, and everything slows down. You may not have menstruation anymore, which from a sensory point of view can be very painful. And so the reality of it is none of the group therapy that we're doing under the guise of anorexia or an eating disorder is going to be beneficial to autistic people if we don't look at it through that lens. And abuse. The frequency of abuse is really astronomical, and this is not news for you. So let's get into the COVID-19 issues. So retrospectively looking at what we've already examined, there are challenges with just using the telephone to make an appointment. They have a lot of phobia around it. They don't know who's going to answer the phone. They don't know if they're going to be treated with generosity or if they're going to be rushed. All those things make people inhibited about using the telephone to even call and make an appointment. Many people would maybe prefer to use the internet, but they may not have access to the internet. So until we have infrastructure to ensure that all disabled people have access to the internet, that's going to be very limited. And even giving them access is not the same as showing them how to use the system. We need to have those systems navigators to aid people who are disabled in learning how to navigate through the internet and other systems. Difficulty with organizing and planning. What time do I leave to get to the appointment on time? There's a lot of presumed understanding on the part of medical providers without confirming understanding. Internal interoceptive issues make it very difficult to report what's happening in your body. So for example, when my son would get an ear infection, I'd say, does your ear hurt? And he'd say, I hear bubbles. Like he couldn't report the pain. We were very fortunate to get that much. I know other people who just have behavior and demonstrate pain with aggression, but they can't report, they can't even point to the type of pain they have or what part of the body it's in. And so that makes it very difficult. My son started limping while he was away at college, and I had to go down and have him have an ultrasound done or sonogram done. because he could not tell us what was going on with his leg and why he was limping. It turned out he needed new orthotics, but we had to do very intensive testing to identify what was happening because of that inability in reporting. Prior medical trauma can be a huge barrier for autistic individuals. I know that I'm on a Facebook group exclusively for women who identify as female, and the number of times I see posts in that gray literature about autistic women refusing to go to the OBGYN because maybe they had a UTI and they were restrained as a child, or somebody examined them without giving them, time to process, is astronomical. The rates of misdiagnosis and ensuing maltreatment are really high, especially for autistic women. That's why we see so many women being diagnosed between 30 and 60 now. And the reality of it is those misdiagnoses may in fact have been the most presenting feature. They may indeed have a high level of anxiety or depression, but if you don't examine for that underlying developmental condition, you're going to not give them adequate support. Over-medication or incorrect medications, a lack of sensitive, qualified providers with adequate time to meet our needs. So when we look at COVID-19, all of this kind of came together as a conglomerate of chaos, to be frank about it. This is from a study by the AIRP, which is, I'm sorry, I'm not gonna be able to put up the acronym, but if you Google it, you can find it. And it's the P means the physical healthcare needs of autistics. And what they determined is that there was a difficulty in accessing well childcare, delays in routine childhood vaccinations. I teach educators at Towson University right now, and their early interventionists in my class are reporting that nearly every child coming in to the EI system is being confirmed as needing EI services because they're more delayed than they would have been had they been accessing school last year. So that becomes problematic. And then the loss of school-based services. So again, they may not have made as much progress through telemed, doing, say, speech therapy or occupational therapy. Just a general inability to access services, doctors refusing to see patients, offices shutting down during different periods of COVID was a huge problem, especially for autistic children and adults who need that co-occurring condition support for, say, seizure management or gastrointestinal issues. Assessments are very backlogged and delayed. Lost opportunities for socialization and play. Some families tried to get around that. I know my daughter and her wife and their son had a pod and everybody agreed to the same rules. But that takes a lot of socialization on the part of the families and a lot of creativity and really great neighbors. And it's even harder to do if you didn't have the luxury of staying home to work. So much loss in this time, just so much darkness of family members passing away, friends, people who ran the local restaurants, all of these people who provide autistic people this sense of predictability. And I'll be very bold and frank. When I heard the presentation I'm sharing with you from the AIRP, I asked if they just simply had in their demographics one question to ask if the family reporting had parents on the autism spectrum, and they failed to do that. And that's with autistic advisors. So I was really disappointed that we didn't examine whether there were any other experiences that a family whereby one or both parents are on the spectrum might have reported. That was just completely missed in the research. So it was kind of disappointing for me. So in this research that we reported on, that Ariel Schwartz directed, we only had a sample of 109 people. It was very early in the process. We recognized the privilege of this sample. We just did not have time to negotiate with gatekeepers which would have provided us access to a more diverse sample, but we went with what we had. And of 109 people, 61% made more than $45,000 a year, 88% were white, 79% of those reporting were female, 77% had a 4-year degree or higher, 54% of those people reported employment changes due to the discontinuation of the job, loss of PT, loss of job coaching, organizational shutdowns, transportation issues, and a loss of peer support. And these are statistics for people for whom they clearly have more privilege than the people we weren't able to recruit from. If you are a single parent of a child who's autistic and you have to work full time or maybe even more than one job to survive, you're clearly not represented here, but we can exponentially estimate in our minds the extra layer of complications. What if you're a caregiver to a senior in your house and you're trying to homeschool? What if your job isn't portable? I mean, we know what the implications were. This study by Turk et al. Is really interesting, and it went through May of 2020, which means this isn't, again, current, but there was an increase in the prevalence of co-occurring conditions that are associated with poorer outcomes with comorbidities involving COVID-19. So, you know, the anxiety disorders, the depression, the eating disorders, drug and alcohol abuse within the autism community, and then other comorbidities that we've already talked about that would be clearly, you know, comparable to what we saw in the ACEs studies, gave us really, really critical outcomes. There was an increase in the concentration of COVID-19 at higher cases. Cases at younger ages. Unlike the neurotypical community, you know, IDD in and of itself is a compromising condition that makes it difficult for a person to simply be sick. My son can't blow his nose. So if he had gotten COVID, it would have been a life-threatening situation because he automatically goes from a runny nose to a sinus infection in good days. For someone who can't meaningfully participate in their healthcare, and then we know in these early days, they couldn't have access to support in those environments, the fatality rate was really much higher than it needed to be, both in people that were younger and then, you know, people throughout the lifespan with IDD. Further implications include that 40% of all autistics have co-occurring anxiety without COVID. 10% of autistic people have co-occurring physical disabilities. I think we're going to start to see those numbers come up because we are starting to look at a correlation between autism and Ehlers-Danlos syndrome, which is a genetic condition involving hypermobility. I think for many lifetimes, we've just assumed that hypermobility and autism and Down syndrome were just part of having a developmental condition. But now we're starting to recognize that there is this underlying genetic issue that comes with gastrointestinal issues, that comes with motility problems, that comes with vascular problems, that comes with physical disability where you have loss of mobility. So I would say that number is probably very low. And quite a few of these people may be diagnosed with all of those things that are very concrete and observable and measurable, and their autism diagnosis not even part of the game yet because we haven't identified it. Many people come from those multiply physically disabled communities into their identities of autism. We have increased rates of various chronic illnesses, and we often experience atypical immune responses in the family of origin as well as in the individual. So higher rates of asthma, allergy, you know, reactivity to vaccines. I want to be clear and say vaccines don't cause autism, but we do see people who have abnormal responses at lower doses to any kind of medication intervention. Uncertainty is reported by the autistic population as being one of the most challenging issues, just the never ending, when is this going to be over? When am I going to get my services back? When will I be able to be with my family? Like all of that unpredictability was really, really challenging for the population. You know, my colleague Jackie talked a lot in her article about the difference between forced isolation versus selectively preferred integration. You know, we have been hearing these stories about how autistic people, many of them thrived in the isolation, but far more of them did not than what we're acknowledging. Yes, working on a dissertation right now, being away from my family has allowed me to do more productive work. But I have a person here in New York, and when my person became overwhelmed with COVID. They're not autistic, but when they checked out and would just said, I'm in such a dark place, I don't want to have contact with anyone. It created huge panic in me because I didn't have anyone else. And if I got COVID, I didn't know what that was going to look like without support in a hospital environment. And it was very scary for a couple of months to 6 weeks. And then I kind of regrouped, but it was tough. And I was also with that unpredictability thinking, you know, my husband and my son both live in the Cincinnati area. My daughter and her wife live in Louisville. And if any of them had gotten ill, I'd have to be on the next plane before planes were really safe and we knew what to do. So there was a lot going on for me as a person. And I'm pretty bomb-proof. I'm fairly constant in a crisis. So if it was affecting me that way, I can only conceptualize, and I've watched a little of it in my son, who is, you know, more vulnerable to anxiety and the what ifs. How it manifested for him was food hoarding. He has ARFID. He only eats a handful of foods, which we've modified to make them as healthy as possible. But when he could not get Kraft macaroni and cheese, it was a bad problem. It was crazy. And we were fortunate that one of the local stores had somebody working at the front register, and she said, how many boxes do you need? And we literally bought a case of Kraft macaroni and cheese, the shell kind, not the noodle kind, you know, because that's his same food. And that is still permeating right now. He's still hoarding certain foods that he's afraid he won't be able to get, and you know, so I don't know how long it's going to take for him to do that. And unpacking trauma in an autistic individual who struggles to expressively communicate is very, very complex. You know, there were higher rates of denial of essential services, more in-person abuse. And, you know, the panoptic experiences of utilizing Social Security, these unreasonable burden of proof issues, unreasonable delays in services and service decisions became multi-layered as things went on. And so I think it's rather ironic that these COVID long haul people who do need what they need, I'm not denying that, who have less visible, less measurable, less tangible needs without a long history of disability are only now becoming aware that many people on the autism spectrum have endured that exact sequence of problems in terms of accessing Social Security. Then there's this massive flood of new applicants, both for retirement, because they were bought out to get them off the books for these corporations, and then an increased workload of people with these long haul symptoms with fewer personnel. So the system is in a crushing mess right now. It's not good. And then systems navigators finally come to the surface in the Senate for the first time. For LGBTQAI people and trans folks, my colleague Elizabeth Graham, who works for the ARC in DC, and well, in Maryland, and who is a trans woman, has reported back to my class last week that the Walt Whitman Center and LGBTQ Community Health Center in Washington, DC are seeing 25% more patients than they did before the pandemic, and they can't take new referrals, and transgender support groups have also maxed out. And I can say I ran a women's support group for AA&E before they merged, well, before they were AA&E, I merged with AHANY, Pat Sissel's group. And we had around 10 or 11 women from the greater New York City area meeting in person in Manhattan and Midtown. Now, of course, we've gone online. We've lost every one of those in-person patients. And now our group exceeds 12 to 15 people every single month, and they're from all over the world. We've had people from Canada, Cuba. I think we had someone from France. So the need for additional support services is really, really high right now. And, you know, we haven't even talked about the homeless population. You know, many autistic individuals are on the streets due to either having, you know, being homeless, losing their parental support, or being, you know, marginalized with the additional intersectional identity of being LGBTQ plus trans. they can't have access to internet service if they're on the street. And, the early closures and the limited hours in the public library made their survival even more complicated. So how do we move forward? Well, we need to reassess healthcare access for all autistics and their families. And I'm excited to be involved with several projects that are looking at that. The AIRP system is part of that. I'm on the reproductive healthcare and sexuality group for AIRP, and we have autistic researchers on all of those committees. Our environments need to be more accessible, especially low-income environments. I've taken people to city-based clinics for healthcare and simply asked for separate waiting area that wasn't so loud, and they looked at me like I had 8 heads. And that should be the easiest accommodation to provide, whether we're talking about a healthcare environment, a clinic, whether we're talking about Social Security offices, the SNAP office. They need to be more prepared to provide reasonable accommodations in those environments. We need to improve our data collection to make sure that people with IDD are in all healthcare and school records. I'm not 100% sure about New York, but I know in other states I've lived in, 504 does not necessarily identify a student as having autism and in some school settings. So when we go to do a head count in the building, we're only counting students qualifying under IDEA. And so we may be missing people. We need to expedite cases and lower the administrative burden for paperwork for people with IDD. This isn't like the traumatic brain injury or some illness where there's a chance things are going to change dramatically. This is a constant state of being throughout the lifespan. And while I would agree that the need for services may look very different, I always say, if you'll campaign for me to have in-home support 10 hours a month, I'll campaign for your kid or your loved one to have one-on-one 24/7 support if that's the level of their need. But we have many, many people for whom we're not providing any supports whatsoever. We need to make sure that the Social Security system is accessible such that third-party support is not automatically required. And we need to make sure that system navigators are available if they're going to have to navigate the system that's a panopticon of opacity and very difficult to get through. So I apologize, I found a typo in this yesterday. So in terms of healthcare, we need to presume competence. This is basic 101. I'm preaching to the choir. You folks already know this. We need to respect gender diversity and the language that goes with that. And that includes identity first language. I use identity first language. I talk about autistic people as a group because that's what the autistic community overall has asked for. On the rare occasion where autistic people haven't ascribed to that, it's because they've been immersed in a parent-driven community of people who haven't taught them what their options are, frankly, in my opinion. I was so excited at an ARC meeting. They were talking about in the self-advocacy breakout session where I was the co-chair that we need to use people first language. And a young man with autism stood up and said, or with Down syndrome stood up and said, I have friends who are autistic and they don't do people first. And so, I'm not saying one is better than the other. I'm saying just ask as you would so that you don't make presumptions and you're culturally humble to what that person prefers. Try to shake the idea that we see in all these false misleading ads in popular media that autism is white and male. There is no evidence that that's accurate. When you look at adult incidence rate representations, there is no disparity between men and women. So we need to stop that. And I also think, by the way, as a caveat, that the quiet, withdrawn, shy, autistic male is getting missed as frequently as the female. Again, ask about that preferred language, and that includes trigger words. One young man I knew had difficulty with a Taekwondo coach who kept yelling at him. I don't know why coaches think yelling works. It doesn't work for our population. And the teachers would say, he's encouraging you. And ever since then, anytime anyone uses the word encouragement, it signifies someone's going to scream at me. So, ask about those trigger words and the things that don't make them comfortable. Maybe provide a hospital passport format that people can fill in so that the staff is aware of what goes on. If you're hospitalized, put it on the whiteboard, put it on the front of the folder in the practice, whatever you need to do. And again, be consistent and predictable for the stay of the visit, for the hospital, you know, just and don't push through. Nothing drives me crazy more than someone saying very clearly, this is too much for me, and people go, we're almost done. You know, you can't do that. You have to reschedule, but don't give them that sense of unpredictability in healthcare environments. Know the statistics. We've gone over all of this. You know, managing a welcoming healthcare environment can be very challenging. And that, you know, these slides I can make available to you, but lighting that are up lighting, not down lighting, can be very helpful. No TV. I don't know why we think we have to have a TV. If we're going to have a TV, make it headphone only. Soft tiled floors, not linoleum. You know, everything that gives a little to reduce the noise. Odorless environments are the best. Staff should not wear perfumes or scented body lotions. Conversations in the front reception area have to be kept to a minimum and only as related to the care being given, not what are we having for lunch today? Take that somewhere else. Private waiting areas. Uniforms can be very triggering, so having them wear fun things. I know we're doing animal scrubs for the little kids, but we don't do anything accommodating for adults. And aquariums are just like a blast. A lot of people like them, probably not with reptilian occupants. That can be triggering for some people. Again, an accessibility checklist or some kind of a passport, hospital passport is a great idea. Slow down, slow down, slow down. Use a whiteboard so you can combine verbal and technology or verbal and art to communicate. Be flexible about arrival times. Have a gender checklist. You know, how do you identify? Are you male, female, gender non-binary? You know, there's a whole array of things that you can add into that checklist so that people are sensitive to that. You know, find a practice, teach people how to be consumers. It's a medical partnership and you are the consumer. And it's really important for autistic individuals to know that if they just don't have a good rapport with somebody, they don't have to stay, you know, but they also need the skill set to shop for someone who's a better fit. Never accept or disrespect, never accept disrespect or someone who rushes you in a practice environment. And as a family member, you know, or as a coach or as some kind of a social work support person, demonstrate that that's not accessible. Be the advocate that shuts that down so they can see it and observe it and model it. Most importantly, remember to presume competence. You know, the guy on the left was supposed to have intellectual disability and autism, and the bar was very, very low for him. His diagnosis has now shifted to PDD and OS. We did not do any ABA or compliance training with him. We couldn't afford it, quite frankly. I knew it was the new hip thing, but it was beyond us. But we just kind of followed his lead and he led us through doors we never dreamed would happen. I have no idea how or why. And as a researcher, I'm studying resilience on the side because I want to know how this happened. And, you know, people say, oh, he had a great mom and she did all the stuff. Yeah, but I didn't take his test and I didn't push him through the door. He made all of his decisions about the next goal he wanted to achieve. And so never underestimate the competence of that individual. But also don't overestimate the capacity of the other guy. This girl on the left was annoying, invasive, opinionated, ruined the surprises because she always guessed them, you know, inflexible, unfiltered, rude, you know. And so between when those behaviors manifested and when I finally got diagnosed, there had been a lot of ensuing trauma, medical maltreatment. I was misdiagnosed with bipolar on, you know, hundreds of medications over a period of 5 years. It destroyed my relationship with my daughter. We're rebuilding. So just remember that you don't outgrow autism. People who survive it grow into it, but parts of it never go away. And so it took me months to be able to share this image. This is my good friend, Chloe Rothschild, me and another friend of mine at the ARC convention social gathering. You can see Chloe's got her Quolo Pro communication system, her weighted inflating vest, her air, her buds are on her head. She's protected, and I am not. I came ill-equipped, and the rawness and the transparency of me experiencing autistic overload in that moment, it took my breath away, because you think it doesn't show, but clearly it can. So that's it. I'm sorry if it went too fast. I hope it was okay for everybody. Questions? And I have to apologize. I just reminded everybody that his name is John Robison, but I didn't look at the CEO part. I thought my friend John was coming to talk today because he does a lot of employment work. But anyway, that's it in a nutshell. Gosh, I can't see anything. Are there any questions?
So Chairperson Burke did have to jump off, so Patrick Paul will be moderating. But if there are any board members have any questions, feel free to just ask Dina.
It's Michael. It's not so much as a question, but a comment. First, I want to say thank you, Dina. I knew a lot of that, but I didn't know all of it. It was a great presentation. I would just say, as usual, you're an amazing leader, and you are still opinionated.
Well, it's fading, but that's part of being a redhead too, I think. I'm just kidding.
Does anybody else have any questions?
Yes, I have a comment to make as well. Thank you for such an informative presentation. You're amazing. You really,
thank you.
You put so much enlightenment into me. I just wanted to comment about the hospitalization experience. We're part in our area of the Mount Sinai system, and my husband and I started this non-for-profit group called RBC Blue Speaks, and we are also very much involved with the Seaver Center at Mount Sinai Hospital. And through them and through RBC Blue Speaks, we have brought attention to all of the emergency rooms through their 8 hospital systems, that everybody in contact with children, adults on the spectrum need training. So they're now in our hospital a special trainer for children, a healthcare person, that when someone on that spectrum comes into the hospital, we have a sensory, the Vita sensory machine with the aquarium, with the bubbles, with all the needs that a person might need in this experience. So
fantastic.
It is wonderful. I mean, I would love to share it with the group one day. And it has made an impact on many, many patients, and more so their parents, when they see how their child is being helped.
Mm-hmm.
So it's so important.
Yeah, it's very moving work, I'm sure. And, the other group of people that I teach at Towson, one semester it's teachers, one semester it's healthcare professionals. And we have this wonderful field called child life, where people learn how to provide accommodations to very small children, not just disabled children, but children who are hospitalized. And we're constantly campaigning for those child life experts to transition with the kids into the adult programs, because that sensory room and those bubbles may be very soothing again for an adult on the spectrum. And we're breaking through. My friend in that picture, Chloe Rothschild, made a video for the University of Michigan's entire hospital system talking about what she needs to be successful. I had to almost help Chloe out of the car meeting at a conference, and now she's on the national board for the RQS. And so she's a powerhouse advocate herself. She's one of my mentees, and I adore her. but you know, her experiences with healthcare have been, she's had very complex healthcare needs. She's multiply disabled, and so she just basically has been empowered by her family to say what she needs. But if you have language that shuts down in a crisis, or you don't have language, you know, it's just so important for the people on the other side to at least take a pause and change their behavior to compensate for that. So thank you for your work. I appreciate it.
You're welcome. I have one other question. Are you interested in being a professor at Adelphi?
No. We need to have margaritas to talk about that.
All right.
But you know, I mean, I have a family in the Midwest, so it's difficult. I've been married for almost 30 years, and my husband has an OCD tendency in his world, and I have working memory issues, so I have to put everything out where I can see it to function and to remember to do things. So it's oil and vinegar for cohabitating. So, you know, I don't know what's going to happen if we actually have to share a house for more than Christmas break. Yes, I don't know what that's going to look like, because we left Kentucky when my son was in 7th grade, and you know, my son just graduated from college in 2020? No, 2018, I think. And we've lived apart that whole time.
That's a long
And
time.
you know, we always tell people it's the best way on the planet to stay married. But functionally, I don't know what it's going to look like. I may move to Louisville to be closer to my grandson, and then, you know, have my family commute. But that's for another day.
Okay. We just have also an association with the Bridges program at Adelphi.
Yeah. The Bridges program is fantastic. You know, they wouldn't accept my kid.
No.
So anyway, we need margaritas, Mary Lou. We need margaritas.
Thank you.
Thank you.
Okay. Thank you very much, Dina. Excellent presentation. I think John Robinson.
No, it's Robinson. Robinson.
Robinson.
It's a different
Okay.
John. I messed that up.
I heard you say Robinson, so I thought you were talking about the same person. All right. So
sorry, John. I bet that happens all the time. Well, thank you, everybody. I've got another training to do, so I'm going to jump off of here. But let me know if you'd like to have me back. I'd love to come back and talk to you about why Social Security isn't working and what we can do to make it better.
Great, Dina.
Without doing any policy work, we can make parents have better successes. So thanks again, everyone. It was great to see everyone. Bye, Michael. Thank you for singing my praises.
Absolutely. And I sent you a message on the IEP 504 question.
Oh, okay. Thank you. Take care, everyone. Bye-bye.
Okay, so my name is Patrick Paul. Again, I'm the CEO of Anderson Center for Autism, and I'll be taking over at least temporarily until Chairperson Burke returns the next meeting. So our next presenter is John Robinson, who's the CEO of Ability. And the presentation, and we're on a board discussion on employing people with disabilities. And a little bit of an entree into who John is. John Robinson is dedicated to connecting individuals with disabilities toward education and employment through mentoring, workshops, public speaking, as well as job placement. Our Ability is the only disability-owned and operated business dedicated to building employment opportunities through our job platforms, employment webinars, digital profile systems, and personal empowerment. In 2014, the Obama administration selected John as one of 10 national White House champions of change for disability employment. John Robinson is the subject of Get Off Your Knees, the John Robinson Story, a public television documentary seen around the United States and other countries, an autobiography of the same titled, published by Syracuse University Press in 2009. John, if you're there, we can, without any further delay, you can please proceed with your presentation.
Thanks, Patrick, very much. I appreciate it. It's good to be here. It's good to speak to everybody. As a lot of us know, it's National Disability Employment Awareness Month, so I'm losing my voice talking to WebEx and Zoom and Teams, and That's a good thing because I'm doing more of that than ever before. It's a bad thing because normally I travel either train or plane or automobile to meet with groups and do the speaking in person. So you lose a little bit not connecting with people in person, but you gain a little bit in that you get your message out to more people. So I'm glad to be here, glad to talk with you. Want to share with you what we're doing. Want to then share my screen and show you what we've done, and then answer your questions. First and foremost, everything that we do with our ability as a company for the past 11 years has been to build a pathway to employment for people with disabilities. It's extremely important. It's important, and I need to explain this. It's important because of what my personal experience was. I'm a quadruple amputee, born without the extension of my arms and my legs. My arms end at where your elbows are. So there's no elbow, no forearm, no hand, no wrist, no fingers. And then my legs are the lower part of your leg. So if you've not seen me before, I can ambulate. I can walk on my own. My feet are facing forward. Thank goodness. I don't need a wheelchair right now at 53 years old to get around. I am able to walk under my own power. I've been this way my whole life. And so I'm lucky in some ways to be a person with a disability my whole life, and that yet I'm aging into disability more and more every day, as all of us are. So it's a interesting journey. I went to Syracuse University in 1986 to study television, radio, film, and I did that because I had a job developer through vocational rehabilitation in the state of New Hampshire, a man named Jack Smith, who changed my life. Growing up in a small high school in New Hampshire, I was a big sports fan, not able to participate in sports, not physically able to do it, didn't have the ability to connect with adaptive sport in the late 80s, and so needed an outlet. So I spent a lot of time watching sports and ingesting sports, either radio or television. And so my parents, as I became a senior in high school, found vocational rehabilitation to help me figure out what I was going to be, what I was going to do. And I'll never forget the day that that my life changed. And that is, walking into Jack Smith's office, basement office of a federal building in Manchester, New Hampshire, no pictures on the wall, no windows. It's the mid 80s. So Jack Smith is behind a desk with nothing on his desk and no pictures, as I said, and just pulls a piece of paper out from a desk drawer and a pencil and starts taking notes. And he's chain smoking as he's doing this. His face is beet red. He asks me a bunch of questions: who I am, what's my schooling, what are my interests, and then he says, "What do I want to do after high school?" And I said I wanted to work in the sports industry. And he finally looked up from the piece of paper and looked at me, and he asked me the question. He goes, "Is that reasonable?" And I said, "Probably not. 3'9", no arms and no legs. It's probably not going to skate for the Boston Bruins. Probably not going to play football." But he said, "How do you watch sports?" And he really pointed out to me that the way to achieve some of my dream was to potentially work in the media industry. And so applied to Syracuse University, was accepted to Syracuse University, went to the Newhouse School for Public Communications, had a great 4 years working learning at Syracuse, lived with 8 people. So 4 of us were in the Newhouse School in communications, and then 5 were not. So the 9 of us were together all 4 years of college. We became best friends to each other, and eventually godparents to our children, and have stayed in contact for all these years. 4 of us in the Newhouse School all had a very similar experience. We all had good grade point averages, well above 3. We all had internships in our chosen field. We all were able to, get quote hands-on equipment, and that was wonderful. And then we all graduated, and we graduated in May of 1990. And I had a degree in television, radio, film management, and an internship at a TV station in Boston the summer before I was a senior, and a grade point average of 3.3, and references from my professors, as all my 4 peers did. Jim who I graduated with, got a job immediately in Newark, New Jersey. And he's a sports writer, was a sports writer for the newspapers in New Jersey. Eventually moved to Ann Arbor, Michigan, and was a beat writer for the University of Michigan's football and basketball team. Went to law school and now is an assistant district attorney. Jim did very well and started his career on time. Dave, one of my best friends in life, co-wrote my autobiography that was mentioned by Patrick. Dave got a job immediately after college after being the school newspaper sports editor for 4 years, got a job immediately in the golf industry, and has been working for 30 plus years, either with Golf Digest, Golf Magazine, or Golf Channel as an editor. And Pat got a job immediately with the National Basketball Association after an internship for 2 years while he was at school, and now runs NFL Films. So if any of you have watched any NFL film ever, Pat's had his hand on that. And then there was me. And I graduated at the same time and was unemployed for 4.5 years. I interviewed at TV stations from Boston to Chicago, Montreal to Washington, D.C., stations large and small, hundreds of resumes, thousands of help wanted ads that I read through, many letters that went out through the mail with a cover letter and a resume, saying all of these things, and multiple first interviews, 25-second interviews in person at a TV station or radio station, trying to tuck in my shirt, trying to tie my tie, being physically uncomfortable with the clothes I had to wear, physically uncomfortable in getting there because I really wanted this job so much. And 25 times hearing the word no, that the world wasn't ready for me. I finally got a job offer 4.5 years later in my chosen field. A lot happened in that 4.5 years, and I'm proud of all that. But 4.5 years later, I got a job offer with a TV station, ironically, right back in Syracuse. And the TV station in Syracuse, the local sales manager said to me, John, I want to hire you. I want to give you a chance. We've had 3 meetings now, and I believe you can sell advertising. But here's the problem. My boss does not want me to hire you because he's afraid of how much you're going to sue us if we have to fire you. So here's the agreement I made. We'll give you a 90-day trial. We'll print you business cards that say you're an account executive for this station. You can go out and sell advertising, but we cannot give you an existing territory and we cannot give you benefits. But we hope you'll take the job. Will you take the job? After 4.5 years of being unemployed and watching my good friends all do well, and in this time getting married and starting a family and moving from New York to Canada back to New York, I was desperate for a job, and I took the job, and I was extremely successful. My first month in December of 1994, I had $17,000 in new business advertising sales. My first full year in 1995, I was the #1 new business salesperson. And I knew that because there was a contest with the 9 stations that our ownership group owned. And the #1 new business salesperson was going to take their +1 and go to Key West, Florida for the annual meeting in January of 1996. And I was so excited and pushed myself, and I knew I was #1 or #2 all year long. And the Tuesday morning meeting in January of 1996, where the contest was announced, it was announced that the #2 person was going to Key West, Florida to the annual meeting because they, quote, looked the part. They wore the 3-piece suit, even though I was the #1 person. So that's how my career began. It began with unemployment. It began in some ways with discouragement, but it also began with the desire to be successful. And I wanted to be successful in spite of my disability, because of my disability. I wanted to be successful, not because I wanted the job necessarily, but I wanted the lifestyle that it afforded. I wanted the family. I wanted the house. I wanted the pickup truck, the dog, the kids. That's what I wanted. And the job was the outlet for that. And so our ability was started after a great 16-year career in TV. I did very well, made a lot of money, enjoyed myself, met some wonderful people. But our ability was started because I never forgot the pain of being unemployed. I never forgot the vision of having a lifestyle because of the employment that I had. And I realized early in my television career, the more I would publicly speak, that the very few people with obvious disabilities regardless of disability, shared similar experiences. That whether people were neurodiverse or DD or physical disabled or veterans or you know, had mental health disabilities, that we all struggle to some degree. And so our ability started out 11 years ago as a way to mentor people towards employment through positive stories. Very quickly, one of the first speeches I gave after leaving the television industry was out at LinkedIn in Silicon Valley. I'd been to Microsoft, I'd been to Bank of America, flew back out to Silicon Valley for a National Disability Employment Awareness Month thing. And at LinkedIn, had a meeting with them after the speech and said it would be great if you could build a LinkedIn for people with disabilities. And they didn't want to do it. They said, if you want to go back to New York and you build it on your own, we'll be somewhat supportive. And so we came back to upstate New York and we scrapped our idea of telling video stories of individuals with disabilities that were successful, although we had done some cool ones. And we started to code a system where people could upload who they were. Not necessarily resume upload, but literally type in who they are. And then a couple of years after that, the businesses that we worked with, because we were the New York chapter of the United States Business Leadership Network at the time, the businesses that we worked with around New York asked us if we could create a jobs board. And so we did that. And so for the longest time, we had a sign-in system for people to tell us who they are, and we had a jobs board out there, and the jobs board was growing and the sign-in system was growing, but we were running up against emerging technologies. You see, having a website and knowing how much it takes to put all this together, we realized that technology changes immediately, and we needed to meet people where they were. There are some wonderful people on this WebEx right now who are job developers, have been job developers, care very deeply about individuals with disabilities, as Jack Smith did me. But I could not always get a hold of Jack Smith. And what I noticed about our ability was that our website emails, our pings, our phone calls, our text messages were all at hours that job coaches could not be reached, that agencies couldn't be connected to. It was 3 a.m. that I would get an email asking me to help someone find a job. It still is. So we had a meeting with Syracuse University 3 years ago. I was over coffee in the student center, and I was invited to the meeting. It wasn't one that I facilitated, and sat there for coffee. And Syracuse University's Information Technology School said to us, John, we'd like to give you 8 students to work on a capstone project. We're interested in disability and the connectivity to technology, and we'd like to work on something. And we know about you from your work with Syracuse, and we'd like to see if we can work on a capstone project together. What do you see as the problem? Well, the problem we saw was exactly that when people wanted to connect, they couldn't, and we needed to do a better job in assisting all of us in connecting. And then we needed to do a better job in assessing the skill that we all have to do work. You see, I had the skill to sell advertising in 1990. I just had no way to prove it except in an archaic interview process. And so gave all this to the Information Technology School. They came back to us with a proposal that they wanted to use artificial intelligence. In my mind, I had IBM Watson playing Jeopardy. That was my mind. It's ultimately not that. But they wanted to use artificial intelligence to enhance our website, build a better interface, build a better engine, and then make job recommendations or career recommendations through the system. We then collectively went to Microsoft. And so we were awarded 2 years ago a Microsoft AI for Good grant right before COVID hit. And the grant was a wonderful opportunity for us to build our dream, to work with the Syracuse students, work with a third-party vendor, to have the resources to do it, and to use artificial intelligence to build a better bridge. Again, we had the jobs board, we had people signing in, we needed to build a better interface. So over the past 2 years, we've been working on Jobsability, which I'll show you in a minute. And then, as all of us know, and Dina talked about, COVID hit. And so COVID had an amazing and dramatic impact, as we all know, on employment for individuals with disabilities, on the way we are working as people with disabilities, and specifically what happened at our ability. You see, each of the past 10 years in October, I would have been flying around doing this talk at different states around the United States, different countries around the world. And that took time away from what we wanted to build. 18 months ago, COVID hits. We started focusing dramatically on building a better artificial intelligence portal. What I'd like to do right now is show you what we built and walk you through what we built. And then I want to explain how to use it. And then I want to make an offer to each and every one of you. This is the front page of ourability.com. We knew early on 11 years ago in building this company, we could not be a bricks and mortar location. We could not be, and we did not want to be in competition with anybody specifically. We wanted to create, as I said before, a mentor network to people with disabilities to find employment, which quickly became a portal. So our website was, we knew all along, was going to be everything. So in the work that we've done with Syracuse University in creating a better interface, in the work that we've done with Microsoft AI for Good, we realized we needed to create 3 pillars. The first pillar being the front-facing interface. So what we decided to do was to create a chatbot. Again, go back to the image of Watson playing Jeopardy. We wanted to create a chatbot that lived on the front page of our website. Now, also, because of the work that we're doing throughout, with ourselves, but also with our regional partners that we're licensing our products with around North America, we have 7 regional partners, regional partnerships that are in Virginia, North Carolina, all throughout the New England states, obviously here in New York, all throughout the northern Midwest, Minnesota, Wisconsin, and then the greater Kansas City area. We just signed an agreement all throughout Canada, and we're having conversations in the United Kingdom, Scotland, India, and Indonesia. And so this chatbot, Abby, is on our site. It's also on other sites. And we've even placed it on 2 SUNY school disability sites so that we can get outreach out there that if people are looking for employment help, they can come through Abby and find us. Now, since we've built this, what's really neat is other organizations, other entities have come to us and asked us, can we build different questions and answers and intents off of the front-facing chatbot that may talk about transportation, financial planning, healthcare, housing for individuals with disabilities. And that's something we certainly can do. But right now, everything we're working on is building towards employment. So Abby, the chatbot, is going to walk us through. You can either preview jobs or we want people to sign up now. Obviously, the urgency is for people to sign in, because once you sign in, then the real work begins. And so I'm going to sign them into Jobsability. This is the portal that is now international in scope that we've developed with Microsoft and Syracuse. And the very first step here, towards the second and third pillar of what we built, is when people sign up now. And so the urgency that we have is to ask disability service providers, transition coordinators, community colleges, university programs, individuals with disabilities directly to either collectively or individually sign in and sign up now so that we can begin the process of helping one another. I'm going to sign into the system. I'm going to sign into the system with my profile so that you can see, I can show you a little bit about what it looks like once it's completed. But the second and third pillar that I talked about, the 3 pillars, the second pillar here is the second chatbot that we built, which is here on the left-hand side of the screen. Again, we named it Abby, just to keep continuity. Abby, if you don't know, Abby is the first 3 letters of ability, so that's why we did it. Abby is here on the left-hand side of the screen, and the design of Abby inside now isn't to do the other things that we talked about on the front page, but it's to walk people through in a question and answer format the information that we need to assist a career pathway. So what do I mean? There are 7 tabs along the middle of our screen. So we took our existing portal that we built and we expanded it. So what do we need to know? What does a job developer need to know to assist an individual? Well, first and foremost, where are you looking for a job? And so, once I put my city and state that I'm looking for a job in, Microsoft validates it with a check mark, and away we go. The second tab is maybe the most important tab in the whole process, and that's ideal job. What we want individuals with disabilities to do is to type in, or either in the chat bot or type in up here, what are they looking to do? So what are we looking to do? Now I put in here marketing and engineering just because I picked 2 keywords, but it might be food service, it might be computer programming, it might be truck driver, it might be whatever it is. We want keywords that we can start utilizing to run our engine. So the ideal job, it's not as fancy as the old objective in the resume, but it's definitely important because there are keywords in here that we are looking for. Then Abby is going to ask questions on education. What is your education? And it could be anything from none to all the way up to multiple degrees. I'm going to skip over skills for a minute. Abby's going to ask questions on your employment history, certifications or achievements, and Abby will ask questions on accommodation. Now, time out. We do not ask any personal information. We don't ask you your address. We do ask you the city you're looking for a job. We don't ask for any social security information. We don't ask for obviously any banking or credit card information. We definitely don't ask any disability questions. We do not want to know your disability. If you want to tell us what your disability is, that's great. Happy to work with you offline, but we do not ask people's disability. We do ask people to consider accommodations that they may need in performing the job function. And this is important to consider. And so we're proud that we built some accommodation questions into Abby. I skipped over skills on purpose because, again, if ideal job is the most important, skills are the differentiator. And so we thought long and hard about how to match people that may have had the same struggle I had back 30 years ago. And so we knew that we wanted to have Abby walk people through soft, middle, technical skill questions through the chatbot that can better round out who a candidate is. So we built in here numerous skill questions. We are still building in skill questions. And we have the ability then to take one-off skills if somebody wants to type in a skill. The proof of that is one day I got obnoxious and I decided in my own profile I was going to put car racing as a skill. But we put in here the ability to take individual skills or to have people answer questions and so go through the skill assessment question. And so this being a differentiator of somebody that may not have the work history, we knew that skill assessment becomes really key in how we support individuals with disabilities or our individuals ourselves looking for work. The second differentiator is we've been hired by New York State Department of Labor on a small grant to build a training module. And so we've got a training module in here that we have 5 modules right now and growing. But the idea being that we built these training modules, we put together an informative video, and then we have questions down here that people can answer. As you answer the multiple questions below, your progress turns red, yellow to green. But most importantly, the answers are keywords that become part of your profile. So the way that you can continue to increase who you are is by continuing to answer the skill questions, add in one-off skills, and also take the training modules to increase your ability. And over time, obviously, we'll add more skills and we'll add more trainings. The third leg of the stool, the third pillar, I mentioned the front-facing jobs board that we built 6 years ago. It's ourability.jobs. You can find it. Right now, presently, we have 71 companies around North America that we work with, 74,490 jobs right now, if I can see that clearly. We have 74,000 jobs in our jobs board. These are all from companies that are paying us or one of our partners. So they are not jobs that are randomly found. They are paying customers looking to hire individuals with disabilities. In our closed system with Abby, we have pulled in all 74,000 jobs in real time. We are reading those job descriptions in real time. And we're cross-referencing the keywords that are in the job descriptions with the keywords that I have in my skills, my ideal job, my work history, or my training. And so the jobs that are here on the right-hand side of the screen are recommended for me based on my answers. And they refresh each and every day. And so if I'm interested in this job, I can then like the job, I can dislike the job, I can save the job to look at it for future reference, or I can click and apply now, which would take me off of our site and into their applicant tracking portal. This is the work that we've done for, as I said, for the better part of 10 years, but the part of the past 2.5 years with Microsoft and Syracuse University. Presently, what we're doing right now is we're doing this. We're building partnerships in the disability community because Jobsability is a pan-disability portal. We want to work with everybody. We did not build it just for people who are amputees. We did not build it just for veterans. We did not build it just for the DD population, the neurodiverse population, or anyone else. Because what I've seen, which is universal, is employment and the opportunity that employment allows. And we know from those 71 companies that are paying us money to post jobs that they want to hire right now. Just as one example, 2 examples. CVS Health has 40,000 jobs that they want to fill right now. Ally Bank has 400 technical jobs that are remote that they want to fill right now. We know that we have a skill within disability to do that work. And we want to be the bridge that people walk across, no pun intended, walk across to find one another. And so we're really, really excited about that. Happy to share that with you. Happy to share some of my personal story. Even more happy to talk with any of you about how I might present this and work with you, get Jobsability out into your area. And as I said before, we did get a small grant from New York State Department of Labor to have people work with us and walk through the online skill assessment and training portal. And the return on that is we'll help them get an interview somewhere. And so we're proud about that. We hope we can talk with and work with each and every one of you.
Thank you very much, John. It was a very informative presentation. I want to commend you for everything that you've done in order to help support individuals with disabilities. I think it's phenomenal. And I think we can probably open this up to some questions. So if anybody has any questions.
Don't be shy.
Well, if no one else has one, I do have one for you. How effective has this been? Do you have any information on how many connections have been made, how many jobs have been found by individuals looking for, or the match made?
Yeah, so we know the connection, we know the clicks, we know the views, we know which job descriptions are clicked on and gone off to. Unless we're told by the business, we don't know the hires. And that's no different than a LinkedIn or Indeed would be, because you just wouldn't know that. But we do know down to, it's pretty interesting with the database and Microsoft and Power BI, we know where anybody in the system goes and what they look at. So what job descriptions, what views, what clicks, etc. So for the businesses, we know which businesses rise to the top. We know which job descriptions rise to the top. And we know the candidates, who's fulfilled the training side and the skill assessment. What, the statistics that I can report to you, because I've got to be somewhat careful, is we've increased our businesses. Like I said, we're up to 71. We've added hundreds of individuals with disabilities each month, which is great. So our partnerships are growing, and that's reflective of the numbers of people. We know that our unique users, both on jobsability.com and ourability.jobs, are increasing each and every month. So ever so slowly, and I say that only sort of half joking because obviously with all of us with disability employment, we're trying to, work at the speed of light, but it's working. I'll tell you a couple of anecdotes. I gave this presentation to VR in Virginia, to DARS, and was interrupted by a business, which was cool. The business interrupted my presentation and said he just wanted everybody to know that they found an employee through Jobsability and wanted to share that with people. Again, I wouldn't know unless they report back to us, but that was wonderful because truthfully, we're at the mercy of Virginia Ability to promote this and get this out there. So we know that there's some success. On top of that, I know that both Ally Bank, Truist Bank, and CVS are investing their time heavily into this, which means they're seeing what they need to see to do so. So, we're really proud of that. We're also proud that they're trusting us with all of their job descriptions, and they're taking in candidates with disabilities to all of their job descriptions. So we're really pleased about that. I should say to each and every one of you, that work continues. So we're not stopping with what we've built. We're constantly building new features. So presently we're building third-party access so that we're building a sign-in so that if you're a job developer or an organization working with multiple people, you'll be able to see multiple people's profile once you've been chosen as the job developer. And then on the other side, on the business side, we're in the process right now of building an ableist language detector, which will filter through all 74,000 jobs, make recommendations based on changing language back to the business and making the language more inclusive for our communities. So these are things that, because we built the tech, we've got things that we can build off of it, and we're pretty excited about that.
Great. Well, we appreciate you taking the time out to come and let us all know about it. I'll give another opportunity if anybody does have a question.
Yep, go ahead.
Good morning. That was a very inspiring and encouraging story you gave us. Thank you. My question is, what about part-time employment for high school students? I was approached with a student who on the spectrum cannot find employment. His parents had, asked if I could help, and that's probably one of the most difficult answers because I don't know how to help. His parents said that, he went to McDonald's in a three-piece suit and they wouldn't hire him. Is there any kind of path for individuals who are not ready to make that full-time work, but, want to get into the work field?
Yeah, Mary Lou, I think it's a surprising number of individuals that have signed into our system that are looking for part-time work. So I don't think you're alone, or that individual's alone in what you've heard. And one of the things that we've done, especially in New York, and we've asked our other partners to do it, is to make sure that the jobs that are posted are inclusive of internships, part-time work, and remote work. And so, maybe in the old days, the jobs that were posted on the jobs board are just, they're the top full-time positions. The truth is, we know that from our disability communities that part-time work is important and remote work is important and internships are important. So we've asked and advocated that each of the businesses include those in their general job postings. And I think we're seeing more and more businesses change the way they think about whom they hire and change the types of positions into part-time and more flexible situations. When I say CVS is looking for 40,000 people, they're not 40,000 full-time jobs. They're looking for people. So, one of the nice things, the blessings that we have is as a, statewide / national organization, when we work with 71 companies, we're starting top down. So we're not working with the local McDonald's down the street. We're working with McDonald's and the ownership groups, and then that trickles down to local leadership. Again, CVS, to pick on them a little bit, I'm working directly with Greg Schmidt, who's in charge of this for the country, who trickles down to the hiring managers in the regions you know, and then I can say I've got somebody in Mid-Hudson Valley who's looking for a job, and then, you know, help them in that way once they've come through the system. So I don't think what you heard is unique. It is not a surprise what you said. And so what we all need to do is to make sure that the part-time, remote, internship, et cetera, positions are included where the full-time ones are. And so that will only assist our community with further hiring opportunities.
So since I haven't seen your website yet, are there indications for part-time where employers are seeking part-time work?
Yep.
You know?
You'll see part-time jobs in there. Absolutely.
Thank you.
You're welcome.
I think there's one more person, Judith Gleason.
Yeah, Juan, I think you'll have to unmute Judith Gleason. She's a member of the public, so if you could do that.
Yeah, just to be, it's about 10:50 now, and so the public comment announcement period is could start now. But I really just want to thank John, and I don't know if John, you can hang on a little bit, and people may have questions during that time also.
Happy to.
So great, so we can proceed.
All right, thank you. Judith, you should be all set.
Oh, can you hear me now?
Yep, we can hear you.
Great, thank you so much. I was wondering, this is amazing. I can't believe we have this set up. I'm wondering if everyone is aware we have a self-direction program, which helps a lot of autistic individuals, and they are struggling to find work. The system, OPWDD has a system for SEMP, they call it, supportive employment, and it gets really involved trying to help these individuals find what they're looking for. So I'm looking forward to joining this. Is there any way I can log on as an individual without a disability? And is there any restriction on who, you know, sets up an account with you?
Judith, I don't know if you have like I said at the beginning, we don't ask people's disabilities. So if you want to log in and you know, sign in as a user, please do so. I mean, that's fine. Listen, if we want to help our community, and if helping our community, we have allies that understand what we're doing, you know, we're all in on that. And so we would love that. As far as OPWDD and self-direction, I gave this presentation 2 days ago, and Lynn was in the room, and so she heard what we're doing, and we're going to speak. You know, we built a system to be supportive of existing entities, existing organizations, existing states, to make the process smoother. That's it. And the businesses are trusting us with that, and that's what's great.
Oh, this is amazing because we're having so much trouble. This is giving us access to at least companies that would be interested. We have individuals have tremendous ability, and they, you know, they're not getting what they need. Okay, thank you so much for your presentation. It is just amazing. Thank you so much.
You're welcome.
I think Ruth, Carlos, if you can go down the list, that would be very appreciated. Thank you.
Yep, you got it. Ruth Ann, you're all set.
Okay, thank you. This is good. I live near Syracuse, so that's a very good program. And I just graduated with my bachelor's degree. But the thing is, it's been a bit of a challenge trying to find the kind of work I want to do. Like right now, I only about 10 hours a week, but I want to be like maybe 25. And also, as far as the other presenter, I don't know if she's still there. That was a very good presentation, and understanding women with autism, very, very important. I was only diagnosed at age 21 this past February. And yeah, that's also, somehow I would like to figure out how to communicate more with the board members of this committee, because I have a lot of ideas, also ideas about educating first responders and hospital workers and all of that kind of thing about autism. Thank you.
Thank you very much for your comments. The next person on the list, if you could, Juan Carlo.
Riva, you are all set.
Hi there, it's Riva Zawel. I just was curious if we'd be able to get access to the slides for the presentations, which were, by the way, wonderful. So is that a possibility?
So Riva, we will post this entire presentation is being recorded, and so we hope to get it up within a week on the OPWDD website, where there is a dedicated spot to the autism board. And I'm going to look forward to working with Josh to see what ideas he has, so that we can make it more interactive, so that the public can get information to the board, and so that this information can get out there. And so we can work on that. And, as Ruth Ann had suggested and as Josh had wanted, I think we can make that all happen.
Thank you so much.
Great. This next question.
Amelia, you should be all set.
Oh, hi. Okay, so the site is ourabilities.com that you go on to?
It's www.ourability.com.
Yeah. One
Okay.
ability, ourability.com.
Our Ability.
Ourability.com.
OURABILITY. Our Ability.
Okay, thank you. And my daughter is interested in working with animals. Do you know if there's a lot of jobs with that? Because we volunteer, well, we used to, I haven't done a lot, in an animal shelter. And then I also volunteer with her because, one, I have to take her, and two, I have to stay there with her because they kind of see her as a liability. I can't, just take her in there.
How
Even
long
if
has she, how long has she been there?
Well, we were working there for a few years, and then we stopped, and then because of COVID, and we have to go back, and we'll probably have to go through all the volunteer training again. Yeah, they don't know her that well. I mean, I leave her with people that are in charge of, like, the cats. They're there, and if I step out to go to lunch or whatever, they look for me, or they come back and get me, and they're like, you have to stay in here with her. So I'm like, okay, I understand that, they don't want her getting hurt, and nobody, having a problem, but that's something else I have to look for, like, I guess, with doing job coaching.
Yeah.
You will, there's no doubt. And you're going to want to look for a situation where ultimately, that company is more comfortable. But as far as animals go inside the system, I'm amazed to tell you this. You're the first person to ask me this in 9 months. I actually don't know. I don't know if there's any animal positions. My guess is we do work with Cargill, which has, obviously they make food and animal feed all over the world, but I don't know if they have any specific animal positions there. My guess is probably not, because that, shelters and those types of places are not corporately run, they're more community run. So that my first inclination would be no, but you never know. So take a look.
Yeah,
I would.
I mean, there's a lot of, I see sanctuaries, but a lot of stuff is like 45 minutes from us or whatever. And we, or, we've gone on trips where they go to like Zoo America or something. And I'm like, that would be an awesome, I think. And I always ask people, and that's when she was young, we were in high school. She's 22 now. And I say, oh, well, so what kind of skills or what things do they look for? So she could be around animals. She just loves it. That and sewing is her passion.
Oh, cool.
So,
So I would say in that ideal job, I wouldn't put animal in there. I'd put customer service in there, right? Think about what she's really doing with the animal, right? So I wouldn't, like I said, when I was being, sort of goofy, I put car racing. Obviously, that's just a like. That's not something I can do. What I should have put in there is driving. in your instance, don't put animals, put in, customer service or support, something like that.
Yeah, well, we're looking into when she gets done, whether she goes to college and she has her certificate in animal advocacy, and then we continued because we were halfway to an individual studies degree. So she's got hopefully she'll be done in May with this. And we've been working on that because I said just go and get a 2-year degree, because a lot of times now they don't even care what you have a degree in as long as you have a 2-year degree. And I said that might help you get a step up, above into something. You might just to get in the door. It might not be what you want, but hopefully work into something that you would enjoy. So.
Great, thank you, Amelia. Just remember that the public comment period is for not just for John, but anything else that the public would like to bring to the attention of the board.
All right, the next person, Sarah. Sarah, you are all set.
Hello, good morning, everybody. Thank you for the opportunity. Yes, I did want to speak more to Dina Gassner's comments. I thought they were very helpful. Just so you know, I am the mother of a 15-year-old with autism, intellectual disability. He's currently in an out-of-state placement. I am also a professional working, helping people with their insurance appeals in the private sector to ensure that insurance companies come forward and that people can successfully appeal and get to external review with their claims. I was just blown away, like we all were, with Dina Gassner's knowledge and the comprehensive assessment of what had happened during COVID, as it was a large microscope upon the issues faced by all people with autism. I was also struck by her collaborative tone and the way she recognized that we're all in this together. And, if you advocate for me and my support needs in this situation, maybe it's in the home, then, I will also advocate for you when you need 24-hour care. That really struck me because I think that this committee, I hope that this committee and obviously the agency that it's reporting to will continue to recognise the needs of individuals with severe autism who are, yes, they are sometimes spoken for by their parents. And I just wanted to draw your attention to, if you haven't seen it already, the video that was launched last week representing those individuals and the dire straits that many families find themselves in. It can be found at www.actnowforsevereautism.com. The video is a compilation of clips from families. Actually, they're even more affected than my own son, and he's had behavioural challenges, but very, very significantly challenged in accessing care for their family members. And for those persons with autism, and the level they're affected, things like the amazing employment opportunities that have been spoken to today, they're just a dream. And many of these families are trying to just get through the day without ending up in the hospital again. So anyway, the two themes that I thought came out of Dina Gassner's presentation that I feel are commonalities that this committee can focus on are the access to healthcare. Really, really humbled by those stories of individuals and the challenges they face, whatever their very diverse needs. From my perspective, obviously access to behavioral health, mental health care is huge, and I believe it really affects everybody on this spectrum. So I'd love to see the committee take that forward and begin examining the networks and drilling down to the Medicaid reimbursement rates and where the provider networks are thin, because in my professional life, I'm seeing the significant tricks that insurance companies play to avoid payment. And so long as people aren't progressing their cases through the external appeal process, so long as we're not leaning on the Department of Financial Services to really investigate and report on insurance maladministration and failure to provide an effective network, then we're keeping these issues under the carpet. And it's very detrimental to everybody, because we all know that we need to access all kinds of healthcare, whether it is an OBGYN appointment for somebody or it's getting into the emergency room. OPWDD did respond in the stakeholder forums in the summer. We were able to give input on this, of course, and I personally said that I'd seen amazing things from CSIDD and the access to the very knowledgeable psychiatrists, etc., who are familiar with the IDD community. So this idea that Dina Gassner was stressing about raising awareness and making sure that all levels of medical professional are attuned to IDD needs, but also making sure we have specialist help for those who need it, so that psychiatrists and psychologists are versed in IDD and available through the networks and through CSIDD if that money can be used from the Rescue Act to, as it will be, and the 5-year plan, to put that money in to make that help available through the system for crisis behaviors. And then secondly, the other commonality with all of us, whether I'm speaking for families who struggle with severe needs in the home, and whether it's a self-advocate who's able to walk into a job or be supported in their home, there's still this risk of abuse and neglect. So the second thing I'd love for the committee to take forward is investigating, this current ombudsman system and redress. So thank you very much for your time. I do appreciate it.
Thank you, Sarah. Just want to bring to everyone's attention, we're a little bit over past 11 o'clock. I'm not sure what housekeeping we have to take care of before we move on, but I do want to thank all the presenters and everyone from the public who had comments. And I'll wait to find out what the support team here needs to convey to everyone.
I think we probably have time for just one more person. It looks like is signed up, which is Bin Fang. But we do want to announce that the next meeting is currently scheduled for December 17th from 11 a.m. to 1 p.m. That one will, I believe, will be still scheduled to be virtual. But after that, let's work with Josh and the board to see if, how things look for the spring meeting, if that can be in person or not, depending on how things get back to normal. But I think there was one more person with their hand up, and that's Bin Fang, and he's contributed before. So if people can just indulge us for one more speaker, that would be wonderful.
All right, thank you, Greg. Bing, you are all set.
Okay, thank you. I'll make it very short. So my question is about the employment for the autistic young people there. I'm a parent. I help my son to get the job and keep the job as a janitor for the last 4 years. So during the process, I know that it is a very complicated process here. It's not only one part, not just the employer or job coach. It also should be involved as the parents, because the parents should be play a bigger role on this one. But during my experience, I found out after school, the parents always would exclude during the process. For example, I was asked to leave when he doing the pre-vocational training. I was not allowed to enter the workplace he there. I understand all the regulations, all the safety concern, privacy, but the exclude the parents or the family member out of the employee's processful is a big disadvantage, because we know them lots of detail from inside out there. So it is our whole community is efforts to help. I want young men with autism to get a job, to keep a job there. So I'm wondering why after school, we always seems like the parents, family member are excluded during the process. What is a concern from everybody? So what we can do that? But I definitely think that the parents or family member should be there, our individuals' life for many, many years, many, many experts. So maybe it's just my own experience, but I really know other people have the same one. So I think that the one I would like to address, to hear some feedback, and then maybe we can look in what we can do about it. Thank you very much.
Thank you. So with that, I think we can conclude. So again, thank you everybody for everyone's input and comments and time.